again, everyone, in the Cincinnati tri-state area, and welcome back to another Facebook Live with us here at the Plastic Surgery Group. I am Terry.
And I'm Joyce.
And we are in the marketing department here at TPSG, and today we're being joined by Dr. Hummel.
Hello.
Who is going to introduce us and talk to us more about actual breast implants. Now, I know a couple of months ago we did a breast augmentation 101 with Dr. Columbus, where we just kind of talked about the basics of the surgery and kind of went over, just a few minor things. So we're going to get a little bit more in depth with you today. But as always, if you have any questions, please leave them down below. And Leslie's back with us today as our camera person, so she'll be yelling out the questions if you have any, if you feel like we haven't covered anything that you want to know about.
So this is something we really wanted to hit on again because we're offering an incredible special this month, and hopefully maybe we'll extend it next month. I don't know yet, but it's a great opportunity if it's something you've thought about. $5,100 all inclusive. That is saline or silicone implants, and this particular offer that we've got, you can add an area of cool sculpting, a cycle of cool sculpting, or a syringe of Restylane if you want to plump the nasolabial folds or give yourself a fuller lip, or you can select an area of laser hair removal. So you could do the bikini or underarms in addition to getting that great special on the breast aug. This that we're doing today is Dr. Hummel's going to talk about the implant placement and everything, because these are questions that we get on a daily basis.
All the time. So
we've been trying to field questions that we take on the phones and hopefully give you a better understanding of what the consult looks like, how the procedure actually rolls out, a better understanding for what the doctors are looking for when they're actually doing an exam. So Dr. Hummel, you want to take it over?
Sure. Thanks for joining us on Facebook Live. So yeah, the topic of today is Implants 101. I think when people are looking into breast augmentation, they can get overwhelmed with the different types of implants. So today we're just going to take a little time kind of sorting that out. Overall, breast augmentation has a tremendously high patient satisfaction rate, and whether we're talking about saline implants or silicone implants, I think people are picking from two good products, and they're going to be happy either way. That's the first, when we're talking about implants, saline and silicone is probably the first step on the decision tree. Again, they're both good implants. I think most people would be happy with either one. The trend is more back towards the silicone. They've been proven to be safe. They've made a lot of improvements in the silicone itself. Saline, there's never been any controversy over, but the drawback of saline is mostly to the touch. It doesn't feel as natural as silicone in terms of breast tissue. And most people call it rippling or wrinkling, but you can kind of feel a little bit of the scalloped edge of the implant.
Probably if you don't have a lot of tissue.
More of an issue with thinner individuals without much breast tissue to cover the implant. I would say in my practice, it's probably 80-85% people are picking silicone these days. Then when it comes to silicone, you can be a little confused too, because a lot of people have heard the term gummy bear. I would say all the main improvement they've made in the silicone implants lately is their cohesive gel technology. The older silicone implants, even while they didn't cause disease, and that's been proven, did have problems with leakage, and used to be a liquid silicone inside that could leak out and lead to some scarring around the implant. So now it's this cohesive gel. Gummy bear is kind of an analogy where if you take a knife and cut it in the implant, nothing comes out. True gummy bear, that's where it gets a little confusing. The main thing I'll show you here, some implants are shaped. I'm not sure how well that's coming through.
Yeah.
And some are round. The shaped ones have a little more of a gummy bear, a little more of a highly cohesive gel. This can lead to a little more firmness to the touch, maybe a little firmer than natural. The other problem with the shaped or form stable implants is that if they rotate in the pocket, we got a little diagram up here, but if you put it in oriented correctly and it rotates a little bit, then that can be a problem that would need surgical correction. Round implants really take on a teardrop shape anyway from the side, and there have been good studies showing that you really can't tell the difference.
Sorry, if I'm moving a little bit, I'm getting closer so I can see what he's doing. Okay.
But just kind of showing you that a round implant's going to take on a teardrop shape anyway. If the procedure's done in a certain way, meaning it's not a really tight pocket, a round implant isn't going to give you a round fake look if you don't want that, which most people don't. Some people do, and that's fine. So that's the main difference. when you're getting into silicone.
You usually place that under the muscle, correct?
Right, we do a little diagram up here on the if Leslie can get that.
Hold on,
Just
let me move closer.
it's just showing a diagram. Implants can be put underneath the chest wall muscle, the pectoralis muscle here, or it can be put above that muscle in front of it and just behind the breast tissue. In my practice, at least, most implants go behind the muscle. They tend to hold up a little better in terms of shape, less problems with scar tissue buildup around it. Certainly with a saline implant, going back to that, you would not want to put it directly under the breast tissue. You want a saline implant for sure under the muscle, just to decrease that rippling we talked about before. But either one's an option. Like I said, most women do well with round, smooth silicone implants or a round, smooth saline implant. But it really does need to be individualized for each patient. Depending on the degree of ptosis or sagginess of the breast, sometimes asymmetry can be an issue. So certainly a board-certified plastic surgeon would be able to walk you through the decisions. If we are talking about round, smooth implants, which again is the majority of my practice, then you get into issues, profile. A lot of people know, is it a high profile, is it a low profile? And the profile is probably what it sounds like. It's how much forward it comes, and how high it is.
If I can get, like you can see. So
So-
yeah, you can kind of see how they.
Yeah, we
different.
pulled a couple of implants. These are all basically the same volume. These are all about 325 cc's. But you can tell to get the same volume in, we're reducing the diameter and increasing the projection. So if we come back to our stylized representation here,
Who drew that, by the way?
I think,
I think Joyce did that.
So when someone comes in, some women are very narrow through the chest, and if you tried to put a lower profile implant in with the same volume, it would be too wide. Other women have a wider chest, and if you were using a high profile implant with a wide base diameter, then that might get them larger than they want to be. So my starting point is getting the dimensions. Part of the initial consultation is measuring that base diameter, figuring out what's going to fit well. Personally, I don't like it if there's a large space between the breasts, so we want to accentuate the cleavage, want to keep the nipple centered. So I have about, once I do these measurements, there's probably at least 4 or 5 or maybe more different sized implants that would work. And during the initial consultation, if the patient has time, we like to try on these different implants in a bra we have here in the office and give them an idea what things are going to look like proportionally.
That's such a popular thing too that you offer. I've noticed when I've been in with patients and they get to try that on and then slip something over the top, you know, as long as the bra is nice and snug, and they can really get a feel for what they'll look like ultimately in clothing, and that seems to help people make a decision on what size they really truly want to be.
So the profile gets generated out of the patient telling me what volume they want, me telling them what diameter I want, and then it's just three-dimensional geometry. That's kind of where the profile comes out. So it's not worth, again, that's all individualized with each patient. I always try to have a patient come back a second time before the actual breast augmentation procedure, and we can try on the implants again. We don't make any final decisions that first consultation. We make notes of what the person liked, and then when they come back, typically have them try them on again if they want. And that just leads everybody know. There's always a big concern that patients, on the patient's part, that they're going to be too big.
Too big.
And obviously that we don't want anybody feeling that way afterwards. So I think trying them on really helps a lot.
The other thing that I was going to say too, obviously this drawing that we did is pretty symmetrical, but the other thing that I know, Dr. Hummel actually did surgery on my family, my daughter, and did a tremendous job. But you know, if there's an issue where you feel that you've got one breast a little bit larger or smaller than the other, and that's a concern for you, this is a great way, with the expertise of our board-certified physicians, you can kind of rectify some of those issues. And there are a lot of breast conditions. You mentioned ptosis before. people sometimes are not aware of what ptosis is, but that's as an augment doesn't work for you because you've lost volume in the breast, and so your breasts may be a little saggier than they used to be. So sometimes an augment is not the right procedure for you, and they can assess that when they're in. But explain to them what you do then when you're measuring, like you take a measurement from the...
Yeah, typically we'll take a measurement from up here, what we call the sternal notch, up there at the top of the sternum, down to the nipple position on each side. Oftentimes there's a discrepancy with one sitting a little lower than the other. Other measurements are performed as well. Again, just dimensionally planning what is going to fit in there the best way. So 3 or 4 measurements, it's relatively quick, and then we move on to trying the implants.
So Teresa wanted to know, how long are implants normally good for? Is there a time when you need to replace?
Mm-hmm.
Yeah, that's a good question. There's no, and you might get different answers from different surgeons, but first of all, there's no time that you would have to come back and have implants removed and replaced just based on the number of years. It would really be, if someone's young and they have an augmentation now and they live to be 100, there's a chance those implants could last the whole time. Mm-hmm. But if there's ever a change that indicates there might be a problem with the implant, then we would obviously do an exam, and with a silicone implant, an MRI test can be done. That's the best test to answer the question if a silicone implant's leaking or not. The FDA in 2006, when they brought the silicone back on the market, one of their recommendations that I really don't think too many plastic surgeons think need to be followed is that starting 3 years after the augmentation and then every 2 years going forward, an MRI should be done to check for a silent rupture. It's expensive for the patient. Typically, if there's a problem with the implant, there's going to be a change in the physical exam. The patient's going to be aware of something. So I reserve MRIs for when there's an issue like that, there's been a change, and I bet it's been 3 or 4 years since I've even ordered an MRI. So I think that can scare some people if they think they're looking at the expense of an MRI every other year. And although it's an FDA recommendation, it's not the law. It doesn't have to be done. The other recommendation the FDA came out with is a woman should be 22 years of age before she gets a silicone implant. I think if someone's under 22 but still would do well with silicone in terms of they're thin, not much breast tissue, it's certainly an option to do that. So silicone implants are available even if you're under 22 years of age.
So did you say silicone, this is from Savannah, which gives you more of a natural look or feel? She said silicone or saline? Silicone
definitely gives you a more natural feel. I think appearance-wise, I really don't appreciate much of a difference between the standard silicone and a saline implant. And then going back to the other question, there are different numbers in terms of leakage rate or rupture rates of an implant. I know Mentor had a study, it was only at 6 years, but 1% of their silicone implants had leaked at 6 years. So they're much better technology, and these implants are really on their 5th generation of silicone gel. So they've made a lot of improvements, both in the shell.
I think that's the key. You mentioned that before. I mean, I started in '99, and it used to be if you put an old silicone implant on a glass top, come back a few hours later, there'd be some moisture on the glass. Now these things are impermeable, and I think there's a picture over here actually. Oh yeah, here we go. This is one that's actually cut in half, so you can see how cohesive they are when they're actually cut. You know, they stay together, and the outside structure itself has been improved. So, you know, it couldn't be a better time for the technology in the form of a silicone gel implants.
And I know there was a previous Facebook Live with Dr. Columbus, but just the procedure typically is an hour long. People are under general anesthesia, going home the same day, usually about an hour or so after we're finished. I tell my patients to abstain from any strenuous activities for 2 weeks. most people are driving probably by 3, 4, 5 days.
But, you know, even with my daughter, I mean, there's a lot of people that are so concerned about what the recovery rate is going to be like. So she had Friday and actually had a little bit of a lift, and then back to work on Monday without any issues. We were actually shopping at Kenwood Mall on Sunday.
Mm-hmm.
So, you know, I mean, everybody's going to be a little bit different, but I would say it's a much easier recovery than most people anticipate.
Yeah, that's what we hear typically. It's
Right.
not as bad as I thought it would be, and you know, in terms of pain and
And as far as we go, I would say that this is the procedure that we get asked the most questions about, whether we're
All the
out
time.
at an event or
Yep.
just the phone call. So, you know, we've got women from, 18.
It
start
varies.
considering-
Yeah, there is
to-
no age limit. Yeah.
Yeah.
all the way out.
Yeah.
I mean,
Yeah.
Right,
Yeah.
right,
Mhm,
right. So,
definitely.
you know, it's not a procedure that you're limited. When we have an event, sometimes people will say, I think I'm too old for it, but I really want it. So, you know,
Never,
you're
yeah.
never too old. So, if it's something you've contemplated, you owe it to yourself to come in. We do complimentary consultations, and, you know, you have the expertise of one of the physicians to advise you on what would be the best implant, what the best size, what everything else about recovery. And so please give us a call if you'd like to come in and talk to us about this great special that we have.
And you can look. You can get on our
Website.
site and look at our before and after. There's a lot of before and after
Definitely.
Lots
photos
of
that
before and
provide.
afters,
Yeah.
yes, yes.
All right.
And so once again, we're gonna wrap it up, but we appreciate all of your feedback because we love our Facebook friends here in Cincinnati. So once again, always leave us a comment, like and share a video. But if you leave us a comment, you have up until midnight this Sunday, and you could be entered into a drawing to win a free hydrofacial with us here at the Plastic Surgery
We
Group.
keep that going too, because the
Yeah.
hydrofacial's been so incredibly popular, and it's just it's a great way to treat yourself too.
They're
It
amazing.
really is.
Yeah,
Dr.
I
Hummel
love it.
loves hydrofacials, don't you, Dr. Hummel?
You're wonderful.
So thank
Right.
you all again.
Thank you.
Tune in
We
next
appreciate
month,
it.
and we appreciate you.
Like and
Bye-bye.
share, and we'll see you next month.
Okay, bye.
Bye.